start with the axilla. Okay, I will place this in anatomical position. We know that clavicle is the anterior bone. So clavicle is now anteriorly located. Scapula is located posteriorly. This is the scapula surrounded by muscles in front of the scapula known as subscapularis and muscles at the back of the scapula, the supraspinatus, infraspinatus, teres minor and teres major. Okay, so this is the correct anatomical position of the axilla, which is having anterior wall which is formed by the pectoralis major. So this is our pectoralis major muscle. It forms the anterior wall, and this is the lower border of the pectoralis major. So this is the anterior fold, which we can feel it like this. This is the anterior wall, pectoralis major. This is the deltoid muscle, which is present in the lateral side of the shoulder, and you can see there is a groove. This groove between deltoid and pectoralis major. This is known as deltopectoral groove. Deltopectoral groove. Now in life there is a vein here known as the cephalic vein. The cephalic vein starts from the thumb side on the dorsum. It runs laterally like this in the forearm and reaches in the deltopectoral groove, and then it pierces the clavipectoral fascia here and enters in the axillary vein. This is your axillary vein. So axillary vein, thin-walled axillary vein. Okay, so this deltopectoral groove contains cephalic vein. So now, pardon, it is not present at this moment because they have removed the cephalic vein. So at this moment, what you have noted? You have noted the anterior wall of the axilla, and posteriorly there is a posterior wall of the axilla which is formed by this muscle under the scapula. This is known as subscapularis muscle. So this is the posterior wall. All of this is posterior wall of the axilla formed by the subscapular. This is anterior wall. Okay, and then you are having laterally humerus. So there is a lateral wall here, and on the medial side there was the thoracic wall or chest wall, which was forming the medial wall. Okay, so at the lower border of the pectoralis major and lower border of the subscapularis and teres muscles, if you draw, put your hand, this is the base of the axilla. Okay, so when we stretch, the base is here. So this is the base of axilla where skin and fascia form the base, and the apex of axilla is here where the clavicle is becoming closer to the humerus and scapula. So this is the apex of the axilla, and at the apex you can see the vessels and nerves are entering in the axilla. You got this? Anterior wall, posterior wall, lateral wall, medial wall, base and apex. Now coming to the contents of axilla, you can see this is your axillary vein. Okay, and then there is an artery. So this is deep to the vein. As a rule, the arteries are deeper than the vein. So this is your axillary artery here. Okay, this is the axillary artery. Okay, you see that? Vein and artery. The remaining things, these are parts of the brachial plexus. Okay, and you see in relation with the artery, you are having cords of the brachial plexus. Laterally, this is the lateral cord. Okay, on the medial side, this is the medial cord of the brachial plexus, and posterior to the artery is the posterior cord of the brachial plexus, which you can see now like this. Can you see this? This is the posterior cord of the brachial plexus. So this is the posterior cord here. I can face it to you, and like this. So now you can see this is the posterior cord of the brachial plexus. It's here. Saw that? Did you saw that?
Yes.
Okay. So the three cords of the plexus are related to the sides of the artery. Lateral cord laterally, medial cord medially, posterior cord posteriorly. And from the cords you are having branches. Okay. You can see the median nerve here. Okay, so this is the.
How can I differentiate between the nerves and the arteries?
See, the nerve is like a cord and very hard. The artery is rounded and it is little bit reddish.
Oh,
Okay, so this is the artery.
and the veins.
And the veins are again like arteries, but since they are having thinner walls, so they are irregular on their surface. Arteries are very regular, like a tube. Okay, the veins are irregular because their walls are very thin, and nerves are like cord and they are whitish. So this is the median nerve in the arm region. This is the brachial artery in the arm region, and you can see the median nerve, which is coming in your cubital fossa. This is your cubital fossa, and its boundaries are the pronator teres. So this is your pronator teres. Okay, and on this side is brachioradialis,